Gurubhyo Namah. I am Dr. VVS RAMA SASTRY, MD Ayurveda from Osmania University, Professor, Head of the Department of 𝐻𝐿, Postgraduate Department, Government Ayurvedic College, Hyderabad. I am going to present a paper on Madhumeha, its management, Ayurvedic perspective. Coming introduction of the disease, Madhumeha has got a significant role in present day life because the whole disease is totally based on lifestyle management, especially in the present days. In that context, it has got a specific important role in day-to-day management. Now, coming to the disease Madhumeha occupies a major place among diseases, especially in India. Madhumeha, a disease, seems to be as old as humanity. The present day lifestyle is the commonest cause for the disease Madhumeha. This is generally identified in routine course of investigations, but not with symptomatology. Generally, we come across the patient with some vague symptomatology. Those vague symptomatology may give a time's clue for a physician to go for investigations. Those investigations will be definitely supporting the physician to identify this is Madhumeha. This is quite obvious in the present day. Then, coming to definition of Madhumeha. Madhveva mehati Madhumeha. Mehati in the sense urination. Urination is just like Madhu. In that context, it is Madhumeva mehati is Madhumeha. Once again, Madhu mehi Madhusamam jayate. This is his urine is once again is equivalent to Madhu. In these two contexts, Madhumeha is identified. Madhura rasa dominates as a component of Mutra. Mutra starts resembling Madhu. When unchecked at this stage, patient starts yielding sweet smell and taste. This is more important. An interesting information about Madhumeha in olden textbooks, this textbook named as 𝑘َوْटिल्यas Ardhashastra, reference goes like this. In his textbook, there is a chapter by name Parabala Vighata Adhikara. In that context, you come across a specific technique which can induce diabetes to the common man or to the nearest people. In that context, they can simply conquer the disease, conquer the gentleman by inducing the disease in that gentleman, so that he feels himself that is high in his own nature. So in that context, 𝑘َوْटिल्yas Ardhashastra, Parabala Vighata Adhikara, this technique is soot, that is carbon particles after burning, obtained from household lizard with the intestines of the modified frog with honey, that induces Madhumeha. This is a very good reference from old textbooks like 𝑘َوْटिल्yas Ardhashastra. This gives us clue that you can induce diabetes in a common man by giving some specific drug. Then coming to Nidana, the major factors are separated into four. One is Ahara, next Vihara, third Abhigata and Sahaja. This Ahara gives us clue about concept of toxicity. Vihara gives us clue about day-to-day activity. Abhigata gives us clue about trauma, and Sahaja is hereditary. All the pramehas, when not treated, improperly treated, lead to Madhumeha. Vagbhata in his Ashtanga Hridaya said that Marga Avrodha and Dhatukshaya are only responsible for the disease. Visheshna of Medho Dhatu also leads to Madhumeha. This is from Sushruta Samhita Sutrasthana, Medhogata chapters, more important. Then coming to Ahara, Ahara is classified into 3 to 4 steps. One step is Asya Sukham, excessive intake of food. Second step, Dadhi, the Mandaka Dadhi, that is improperly formed the Dadhi, may cause the Madhumeham. Then coming to 3, Viruddhahara, incompatible foods. The concept of toxicity also has got major role in manifestation of disease. Fourth, foods prepared out of new grains. Navannam Mehakaram. This is a very good reference from our Samhitas. Then coming to Vihara, Swapna Sukham, Madhya Sevana, over anxiety and overwork, Bhaktasya Adau Jalam Pitam, Sthulatvam Kafakaram. A very good important quotation from our textbooks. Intake of food with inadequate intervals, sleep with full belly is more important. Basavaraja, a physician in 14th century, observed the ill effect of alcohol producing Madhumeha. This is an interesting observation made by him in 14th century itself. This gives us clue that Madhu, alcohol, causes Madhumeha disease. Then coming to Abhighata, direct trauma to Siras, Kukshi and Vasti, indirect trauma stress and manasika vikaras. Coming to Sahaja aspect of it, hereditary cause of Madhumeha was observed by Charaka Samhita and Susri Samhita. Bela in his Bela Samhita, a very good observation made by him, described as Madhumeha as Prakruta Prabhava besides Sakruta Prabhava. He classified Madhumeha into two categories. One is Prakruta Prabhava, that is genetic. Besides Sakruta Prabhava, it is acquired. So these two conditions are identified by Bela in olden days. It's a very good observation made by him. Then coming to Madhumeha symptomatology. Important is Vagbhata paid much attention to diagnosing the case in the disease in his treatise Rasna Samachaya with the following symptomatology. This observation goes like this: Aswasthyam sarvagautreshu. This gives us clue about affliction of the bodily organs right from head to toe. In this condition, Aswasthyam sarvagautreshu is a very good observation made by him. This is an observation made him keeping in view that diabetic retinopathy, diabetic cardiopathy, diabetic neuropathy, diabetic encephalopathy, all these things are included in this. This was observation made by him in olden days. This really a great observation, and we have to salute him for his intrinsic observation in those days. The condition given by Vagbhata, Aswasthyam Sarvagautreshu, was more observed earlier by Susruta as follows. See, generally we come across a patient with vague symptomatology saying that he is feeling fatigue and other getting loss of weight. In those conditions, we receive the patient with the vague conditions. In those vague conditions, we come across a special symptomatology given by Susruta. This gives us clue that we have a very doubt of the patient, that the patient will suffer from Madhumeha or is going to suffer. This is more important. Then quotation goes like this: Gamanat sthanam, sthanad asanam, asanat sayanam, sayanat sapnam. Gamanat sthanam in the sense, when the gentleman starts walking, he intends to stand for some time. So, sthanad asanam, when once he stands for some time, he wants to sit for some time. Then asanat sayanam, when once he starts sitting, he intends to go for sayanam, swapnam. That's after sayanam, he goes to sapnam. Sapnam in the sense, he is intended to go for straight away sleep. So all these four conditions gives us clue that the patient may go to the disease Madhumeha. These are all very important observations to be made by a physician. These are the directions given by Susruta Samhita in those days. Very important. This gives us clue that they are all very supreme in their observation levels. There is nothing wrong in taking help from modern investigations as far as pathogenesis, as far as identity of the disease is concerned in case of necessity. Then Madhumeha classification, Sahaja dosha is Bija dosha and it is hereditary. Doshaja is Apachanyamachada is acquired. Sthula, a Margavaraja condition, it is stout and hefty. Then Krusha, Dhatukshayam, emaciated. All these four conditions are very important for classification of disease. Then Madhumeha clinical presentation. Madhumeha classified into two different conditions. One is Sahaja and there is Apachanyamachada. Sahaja patient generally will be Krusha in his nature. In those conditions, what we get is, one is Krusha, Rukshatva, Alpasi, Pripasabhisham, and Parisarpanasiyalata. All these five conditions are generally seen in a patient suffering from Krusha state. Then coming to Apachanyamachada, he is generally Sthula in nature. In those conditions, we come across, he is a Sthula in nature, Snigdhatva, Bahuvasi, Sayanasiyala Sukhi, and Swapanasiyalata. All these five indicates that he is a man suffering from Apachanyamataja Madhumeha. Then coming to diagnosis. Diagnosis is generally made on two parameters. One is subjective parameter, another is symptomatology, another is objective parameters. Then subjective parameters are symptomatology, objective parameters are investigations, procedures, conventional modern investigations in case of necessity. And Susrutacharya support the above with a direction saying that Swashastra Kusalaha Anyeshu Shastrardhaish Avayashkutaha. A wonderful direction given by Susruta, an integrated direct approach. This gives us clue that Swashastra Kusalaha indicates you should be more well versed with your own science. You should not leave anything. You should be highly well versed. You should be totally follower of your own science then. And then Anyeshu Shastrardhaish Avayashkutaha. In other science, you should not have any disagreement. At the same time, you should be in a position to simply follow it. You are not supposed to discard it. In that quotation, he directly directs, so Anya Shastra Avaishkuta, you are not supposed to boycott other systems. In the case of necessity, we need not hesitate in taking help from other sciences, so that it is for the benefit of the patient, so that it will be easy for a physician to accept it. Then coming to Chikitsa, treatment, Sodhana, Shamana, Rasayana. These three are very good approaches in the management of Chikitsa. Sodhana indicates in Sthola Prameha only. Sodhana should not be done in Kursa Pramehi. Shamana, in Shamana classification, you can come across three preparations: herbal preparations, mineral preparations, herbo-mineral preparations. Then herbal preparations, when once you see the textbook of Madhumeha, Madhumeha is a textbook of Bhava Prakasha, you come across about 3 to 4, it's about 20 to 30 preparations, herbal preparations. Those herbal preparations I am going to give here right now. One is Amalaki, Amra Pushpam, Atibala, Bhurjapatra, Devadaru, Gugulu, Guduchi, Kampillaka, Katuki, Katfala, Karanjafala, Karanja, Murva, Manjista, Mahanimba, Nimba, Suvarchala, Brahmi, Gojihva, Haridra, Kakamachi, Meshastrangi, Pippali, Pashanabheda, Sarjaka, Varahikanda, Tindukafala, Chatavari Svarasa. Susutacharya, in his exclusive contribution to these drugs, he gave much importance to 3 other drugs, which are Tuvaraka, Mashika and Shilajit. These 2 are herbal drugs. Mashika is a mineral preparation. It's a wonderful direction given by him. Then coming to herbal compound preparations, important being Mudgadi Kanjika Kashayam, Atistholya Pramehadi Rogasya Nivurtaye. This is more important in a patient suffering from Atistholya conditions. This is a very good preparation given by Sastra Yogakara, very important for a quotation. Then Avipatikara Churna. Generally, we give Avipatikara Churna in Amla Pitta and other Anulomana conditions. Then what we do is, Avipatikara Chura can be equally effective. It's found effective equally in the case of Madhumeha also. Pramehan, Vimsadis Cheva Nasham. It regulates, it treats all the 20 Pramehas. It's a wonderful observation made by 𝑉𝐸𝐬𝑗. Then, Nigrodhadi Churna, Vimsati Mehan Prasmam Mayanti, all the 20 Pramehas can be successfully managed with this Nigrodhadi Churna. This reference is from Chakradatta. Then, Pedakan Najayate. If you take this preparation, you don't get the complications like Pedaka. When once you get to Pedaka, it is supposed to be totally full-grown Madhumeha. Then, Pedaka Najayate. You can prevent Pedaka by taking this Nigrodhadi Churna. It's a very good observation by 𝑉𝐸𝐬𝑗. Then, Musta, Devadaru and Trifala Kashayam. Prameha Hrt. This Musta, Devadaru and Prameha Krut. Musta, Devadaru and Trifala Kashaya. Prameha Hrt. This is from Chikitsa Kalika, a textbook from Trisatacharya. This is more important, very good textbook as far as Chikitsa is concerned. This is a very rare textbook, but it is very rather competent textbook for a physician. Then Bhaskar Lavana Churna. What we do is generally in Bhaskar Lavana Churna is given generally in Parinamasula and Ajirna conditions. But in this context, Bhaskar Lavana Churna is really effective. The quotation goes like this: Viseshat Sarkaradiyan Rogan Nanavidhan Naseti. Wonderful quotation. So this being a wonderful preparation by Parinamasula and other conditions, you got a reference about Hridroganut. It's a wonderful drug even to combat Hridrogas. The reference, cross-reference for Bhaskar Lavana, you come across Panduroganut. This is a wonderful quotation. Even in Panduroga, Bhaskar Lavana can be successfully given. It's a successful drug. This is from 𝑉𝐸𝐬𝑗. A wonderful drug in association with other combinations, in association with some other diseases. Bhaskar Lavana can also be given in Madhumeha. Then coming to mineral preparations, Shilajitu, Abrakavasma, Vangavasma, Nagavasma, Jashadavasma, Tamravasma, Rajatavasma and Swarnamastakavasma. All the 8 Vasmas are highly effective in the management of Madhumeha. They can be successfully tried. The basic principle to be followed is these drugs are to be prepared only by a physician. When once these drugs are prepared by a physician, you have got an authority in the preparation. you have got your own, at the same, you have got your own confidence in medicine, then you will get successful results in these preparations. So preparing medicine by yourself is more important. Then you have got a specific condition by name, specific drug by name, Tamara Yoga, 𝘔𝘪𝘳 Sandharayet Nisi. This 𝘔𝘪𝘳 Sandharayet Nisi indicates the sublingual observations of the drug. So sublingual observation of the drug was identified, was noted only some decades back about by Rasa Samuchaya. So this indicates sublingual absorption of drug by name Tamara Yoga gives us immediate relief in Madhumeha. So wonderful relief, wonderful drug taken into consideration. Then 𝐹𝐹 is Madhumeha mapi nihanti asu. 𝐹𝐹, once you take 𝐹𝐹 regularly in a day-to-day practice, this nihanti asu, it immediately relieves your condition of Madhumeha. It's a wonderful difference. This is from Rasa Samuchayam once again. Then coming to herbal preparations, some important preparations are Vanga Prayoga, Madhumeha Nut, Rasa Samuchayam, Indravati, Madhumeha Pranasani, this is Rasa Samuchayam, Dhanvantari Ghrutam, this is Jayet Sarvan Pramehan Pedakopachan. Even if it is done Madhumeha with Pedaka, but also can be treated with this condition, Sahasra Yoga. Lodhradi Kashaya, a wonderful preparation. This is Madhumeha Jit from Basavarajiyam. Bahumutranta Karasam, Madhumeham Hanti. This is a very good reference from Bahumutrantakam, Sahasra Yoga. Sarvestra Rasa, Madhumehan Sudurjayan Hanti. Even if these are all complications which are rigid in nature, also can be treated with Sarvestra Rasam. So Dadimadi Krutam, Pramehan Vimsati Vidhan Haniyat, Na Samseha. There is no doubt about treating some Pramehas when Dadimadi Krutam is advocated. This is from once again Vaishyajaratnavadi. There is one important preparation by name Panchaloha Rasayana Sarva Meha Kulantakrut. This Meha Kulantakrut indicates for diabetic syndrome. So syndrome, as you know, that it contains many conditions along with a major disease. In that context, this particular preparation by means of Panchaloha Rasayana can be successfully given. Quotation supports us in Yoga Ratnakara, Sarva Meha Kulantaka, more important. This is from Yoga Ratnakara. Then there is one important preparation by name Harishankara Rasa, Pramehan Vimsati Hanti. This restricts all the 20 types of Pramehas along with the supporting quotation saying that is a very supporting quotation saying that Satyam Satyam Rasamseha. This is true and true. There is no doubt about it to get the results. So this particular adjective gives us clue that this is more effective. And in some areas in India, this drug is seen in practice and they are getting very good results. Finally, as I said earlier, you should be in a position to prepare your own medicine. Then you will have confidence over it. This is a drug to be prepared only by the individuals. Paramehan, Vimsati, Hanti, Satyam, Satyam, Rasam Seha, a good direction given by Rasan Samuchaya, Rasan Siddha Prayoga Sankara. A very good direction. One should follow this. The name of the drug is Harishankara Rasam. Very, very, very effective drug. Then unique approach, a preparation by name 𝑉𝐸𝑆 Rasam. This 𝑉𝐸𝑆 Rasa is from Rasa Samuchayam. Vagbhatta gave much emphasis on age of the patients, chronicity of the diseases. He has suggested ages like Sishu up to 20 years, 20 to 25 years, 25 to 30 years, 30 to 35 years. These are age groups he has given. Based on the age groups, he has certainly made a very good approach, saying that suggested in different doses with the different anupanas. So this is more important. The Rasa Samuchaya gives us clue to take this preparation. And if anybody is interested, he can go straight away to Rasa Samuchaya second volume. That gives us clue that the dosage is also very essential. And based upon the patient's age, dosage should be settled. And this is very important quotation you should take for your day-to-day practice. This shows us their monumental approach. They took the entire dosage of the medicine and the name of the, age of the patients. With these conditions, I am sure that the drug will be definitely working on those conditions when once it is taken in time and administered in time. Coming to management of Madhumeha, you come across with different nomenclature for Madhumeha. With those things are Madhumeha Prashantakrut. One adjective is Prashantakrut. Second adjective is Sudirdhayam Hanti. Third, Nihanti Asu. Fourth, Madhumeha Nut. Fifth, Madhumeha Prasamani. Sixth, Madhumeha Jit. With all these adjectives, we come across, these drugs are highly potential at particular point. The potentiality of the drug should be decided based on the nomenclature you come across in the textbook. So, based upon this condition, you should be at a position to select the drug according to the necessity of the condition. That is very important. Then coming to Rasayana concept of it, the disturbance in formation and functioning of all dhatus, including ojas, is found. This is more important. Ojas is vitiated in Madhumeha. In that context, ojokara drugs are to be given to this condition. Then, therefore, Rasayana Chikitsa is more required to be educated in Madhumeha conditions. Interesting definition goes like this: Dehasya Indriya Dantanam Dridikaranam Ya Kriya Tat Rasayanam. So, the Deha Drodhatvam is maintained with Rasayana drug. Since Deha Dhatus are afflicted in Madhumeha, Deha Dridikaranam is once again the basic requirement of a physician. Then what we do is, these interesting Rasayanas should be advocated to maintain Dehasya Indriya Dridikaranam, more important. Then important Rasayana preparations, Loha Bhasvam Rasayana Varam, this is from Rasa Samachayam. Shalmali Grutam, Hanti Dhatu Kshayam, this is from Bhaishya Ratnavali. Kaishwar Gugulu, Nityam Upayukto Rasayanam, because a Madhumeha patient required sincerely all Rasaushadhas, and at the same time, this Kaishwar Gugulu has got a specific condition, since it gives regularly to a particular, since it is given regularly to a particular patient. This is Nityam Upayukto Rasayanam, this is Susur Samhita. Then Kantavalla Prasam, Lokasya Arogyakaram is more important. This is a very good drug to maintain community health program. This can be tried in community health program so that you can prevent most of the diseases along with diabetes also. Then Lakshmi Narayana Rasam, Rasayana Nam Uttamam. It's a very good Rasayana taken by Yoga Ratnagaram in those days. Then coming to Patsya. Patsya is differentiated in two levels. One is Ahara level and there is Vihara level. Then coming to Ahara level, diet Yava, Palandu, Purana Dhanya, Takra, Gomutra. These are usually Patsya in Madhumeha conditions. And Chanaka, Tikta Shakam, Purana Kuluttam, Bhojana Matsye Salilam, Medohara Aharam. All the 10 points are really important to maintain Patsya in Ahara. These things are not only Patsya in Ahara, they are not only simply Ahara, they are once again Aushadha Dravyas. These are called to be Ahara Rupa Aushadha Dravyas. So in that way, our science of Ayurveda has got a specific context, saying that Ahara Dravya also is having medicinal property. In that context, our concept is definitely great. In those conditions, a simple Ahara Dravya can be given as a Aushadha Dravya also. That is the beauty of Ayurveda. Then coming to Vihara, Vyayama Padatra Rahito Munivataraha Yojananam Satamgachait Khanetva Salilasya Gramaikaratvam Bhekshvasi. All these 5 points indicate that the normal type of Vihara should be educated. These Vihara, once you educate, patient will be definitely relieved. He will be getting relief, so that these things are absolutely essential. They have got equal importance, because since all the 5, Vyayama, Padatar Rahito Munivat, Yojananam Satam, Jayet, Khanetva Salilasya, Gramaikaratvam Bhekshvasi, all the 4 gives us clue about the importance of diet and exercise besides medication. Coming to Apatsya, Apatsya also can be divided into 2 parts. One is Apatsya Ahara, Apatsya Vihara. Apatsya Ahara includes Dadhi Mandakam, Sura, Kshapaja Maricham, chilies, food substances prepared out of wheat in association with oil. This is more applicable in patients suffering from diabetic retinopathy, because Chakshusyopi Godhuma Thairapakastu Drishtiha. This is a quotation from Ashtanga Sankara. Godhuma prepared in association with oil, it definitely diminishes the sight of the gentleman. In that context, diabetic retinopathy, especially in diabetic retinopathy, you are supposed to devoid of this particular food substance prepared Godhuma with oil. This is more important. Then coming to Vihara, Apatsya Vihara, indiscriminate use of oil, indiscriminate use of cold and chill substances, exerting activities soon after food, excessive indulgence in sex, indulgence in sex immediately after food, intake of water at the end of food. These 5, they have got indirect role as far as apacha is concerned. They may at times create vata vyadhi, that particular vata vyadhi may convert into Madhumeha later on. Then sajya sachita prognosis. Prognosis is made based on involvement of doshas. Madhumeha is asajya by nature. This can be only managed. Pidaka piditam gadam pramehan hanti manavam. When once a patient goes to the level of pidaka, it may take the life of the individual. So you are not supposed to make the patient to go to the level of pidaka. Pidaka may at times give indiscriminate adverse effect to the gentleman. So the patient's primary duty is to prevent from complications and treat the patients right from the Pururupa level and then with specific drugs selected. Then coming to Upadravas. Upadravas are Trishna, Atisara, Jvara, Daha, Dorbalya, Arochaka, Puti Mamsa, about your gangrene, Pitaka, Hruschula, Hrudraha. Sushruta was the first Acharya to mention about heart diseases in Madhumeha. Heart attacks are commonly seen in the patients suffering from Madhumeha. The condition Sparshapada Nishkriyata, word used by Sushruta in those days, this is absolutely equivalent to diabetic neuropathy. So diabetic neuropathy is commonly seen in most of the conditions. This condition was already observed by Sushruta in those good olden days. The diabetic neuropathy also can be successfully managed with the drugs already described earlier. This is a very good observation made by Sushruta. Then coming to conclusion, the disease Madhumeha is often stated as well studied and managed by Ayurveda in those good olden days. In fact, it seems to be well studied and thoroughly understood by Ayurveda even in earlier days. Hopefully, in near future, it would become well managed in Ayurveda by following health education and awareness in the patients. Since the disease is more often found just because of lifestyle, when lifestyle is totally altered, I am sure the disease can be successfully managed. Then the management of Madhumeha with useful remedies is the need of the day, and it is quite obvious that the duty of the physician is to maintain perfect health in the disease, perfect health of the individual by following all the stipulations laid down in the textbook, both at the preventive level and curative level. I am sure that this will definitely help for a physician to give successful relief. Thank you.